Nephrolithiasis is not a modern affliction. Archaeologists have discovered 5,000-year-old mummies bearing kidney stones. Perhaps because kidney stones are an extremely painful condition, doctors have been searching for treatments for thousands of years. The Indian surgeon Sushruta wrote about surgical treatment for stones in the 8th century BC. By the Middle Ages, there were specialized surgeons called lithotomists who traveled throughout Europe removing stones. Since there was no anesthesia or antibiotics at the time, the risk of complications was high, and it was not a popular procedure. Patients even took matters into their own hands. A 1665 painting shows a Dutch blacksmith holding a stone and the knife he used to slice open his own bladder to remove it. By the 20th century, procedures had advanced considerably. In 1976, the first percutaneous stone surgery was performed, quickly followed by the advent of shockwave therapy. Despite medical advancements, the disease persists to this day.
1 in 10 to 1 in 11 patients in the world will have a kidney stone in their lifetime.
In the United States, about 30 million people are at risk for nephrolithiasis.
I've personally never had renal stones, but I understand the pain to be exquisite. And it's exquisite almost for all patients who suffer from this disease process.
Most patients with a kidney stone will present to the emergency room because they have absolutely no idea why they're having such severe pain, and most of them feel like they're on death's door because the pain is so severe. And so the amount of narcotics that you give a patient in a kidney stone passage scenario can be enough to put down a horse in some situations.
The medical costs are over $2 billion per year. The cost to the individual patient depends on the treatment required.
One of the primary managements that we recommend for most patients is to have a patient have a trial of passage of the stone, which means conservative management. And so most stones that are less than 5 millimeters are going to pass.
We've got some patients who had 8 millimeter, 9 millimeter stone that was passing, had no idea. But some folks are just not physically able to pass a stone. Depending on where the stone gets stuck or where we find it, will kind of determine the treatment options that we have.
For patients who have chronic kidney stones, the impact on lifestyle can be significant.
Folks who have stones, they have to think about it on a daily basis. It affects their decisions on food, it affects their decisions on what to drink and how much to drink.
Geography can also determine whether people will develop kidney stones.
The environment that patients live in is a huge part of it. There's something that we call a stone belt in the United States that tends to run south of Oklahoma, southern part of Colorado, and everything south of there, including Florida all the way to the East Coast and California on the West Coast. Anywhere you have a climate that has a potential for dehydration, you have a much higher risk of stones.
One of the highest incidences of kidney stones is in Saudi Arabia, most likely because of the dry desert climate. In addition, kidney stones tend to have their highest rate of occurrence during particular seasons of the year.
It kind of varies on the season, as odd as that sounds. Usually in the summer, because of humidity and all the heat, patients are dehydrated, they're not eating well, they're outside a lot, especially in Texas.
Stones are formed over time, they don't happen overnight.
So we see a lot of kidney stone patients in the fall and the winter, more so than in the spring or summer.
Diet and heredity are also factors, but for most, preventative measures are fairly straightforward.
About 90% of the population has stones because of either dehydration or deficiencies in certain nutrients or dietary supplements that they should be ingesting on a regular basis. Number 3 is there's absorption issues.
Risk factors which can lead to kidney stones include a diet high in sodium, protein, and sugar. In addition, certain health concerns are linked to stones. And some medications and urinary tract infections may increase risk. Whatever your susceptibility, even simple preventative measures may be out of reach for some patients.
You might be asked to take supplements or avoid certain things or have to put other things in your body which you may or may not be able to afford. It can definitely impact the choices that you make throughout the day, and that can be impacted by the choices that you have at your disposal.
In the U.S., lower socioeconomic status correlates to a higher incidence of stones, and these patients may also be less likely to seek treatment, especially if the condition becomes chronic.
Folks who are passing stones or having stone disease constantly or on a chronic basis, patients are having to undergo procedures from time to time, so it can definitely be a financial burden for the patients.
We do have some patients that are non-compliant with their care, and a lot of that is just a lot of cost with healthcare now. We see a lot of elderly patients, so sometimes it's harder to have them show up for an appointment, when they've set an appointment, or to be able to get a ride to have imaging done or things like that.
Prevention is hands down the best way to keep you from having another stone. We're never going to be able to cure the patient.
With no cure on the horizon, education and prevention remain a physician's most powerful tools.